Hello again, I'm Dr. Mark Richmond, one of the anesthesiologists with the Ventura Anesthesia Medical Group here at Community Memorial Hospital in Ventura, talking about spinal anesthesia, analgesia for cesarean section. Most of our C-sections here at Community are done with spinal anesthesia because they're faster. That's our choice mostly for elective C-sections, your breech, or for whatever reason you can't have a C-section by vaginal birth, or the epidural for labor is not adequate. We'll bring you into the operating room and we'll do a spinal anesthesia. Spinal anesthesia is a very small little kit that we use to give you medication in the what's called the thecal sac, and it gives you a spinal from the lower chest, upper abdomen, downward all the way to the toes. Sometimes you can feel your toes, but often you can't. You will feel pressure, pulling sensations during birth. Sometimes the tugging is uncomfortable. Usually it's not too much, and if it is, we can give you medication for that. But spinal is done routinely, where the mom, you might see smiling, holding her baby as the operation is still progressing, because she doesn't feel much of anything below the waist. The spinal medication does wear off in about an hour, hour and a half. We do give medication through the spinal that might give you some pain relief for about 12 to 18, 24 hours. But generally you'll be on other medication when the spinal wears off in that 1.5, 2 hours time for post-op analgesia. If we do an epidural, and sometimes we want to do epidurals, we can march the epidural higher and higher, and that tends to wear off in about 2 to 3 hours. And the epidural catheter comes out after the baby is born. With both a spinal and a epidural C-section, you will have your urinary catheter for about a day or so until you're walking around and feeling like your legs have returned. Thank you for listening. Bye-bye now.
Medtwice.com